I'll introduce you to the instruments we'll be kind of working with today. So here is our needle driver here, and that's for kind of exactly what it sounds like. It's for picking up the needle and kind of driving the needle through. Outside the microscope, it almost looks just like the scissors, but you can kind of see when I bring the scissors underneath, it looks a little less scissory than our actual microsurgical scissors right here. Dr. Bartholomew briefly kind of mentioned we also have a pair of adventitious scissors right here. And if you compare those to our dissecting scissors right here, the adventitious scissors, they have a real kind of pointy little tip to them. We really only use this for one step of the entire procedure, and that's for trimming that adventitia. It's nice to have a nice little, really small, sharp set for that. But you wouldn't want to dissect with these scissors because the tips are so sharp. If you accidentally bump into something, you'll just poke holes into it. Whereas it's kind of subtle, but if you'll notice the tips on these scissors, which are the dissecting scissors, they're a little bit rounded. They're a little bit blunted. If you run into something here, you're not going to kind of poke holes into them. The other instruments that we have, are here's our forceps right here, and this is going to be great for grabbing tissue. You can tie with the forceps. It's just for grabbing things. And it's very similar to another instrument we have, which is the vessel dilator. And so if you were to kind of compare these, here's the vessel dilator here. You'll notice that the tip on this end here is nice and blunted, and it's a little bit bulkier than this one right here. It's this bulkiness that is going to it's this kind of blunted tip here that's going to make this really the only instrument that's safe to put inside of a blood vessel. If you were to put the forceps inside of a blood vessel, these tips are so pointy, you can actually kind of damage the blood vessel from the inside here. So the vessel dilator is really a pretty important instrument whenever you're doing kind of microvascular procedures there. So those are kind of the four kind of bread and butter instruments that you'll be using whenever you do microsurgery.